Hello, my name is Katia Martinez, and today I will be lecturing on the topic of spina bifida. I will cover some of the characteristics, defining factors, history, prevalence, some research-based instructional strategies, as well as teacher and parent web resources. First of all, what is spina bifida? Well, according to the American Pregnancy Association, spina bifida is a birth defect that occurs within the womb. It's a kind of neural tube defect. This means that when the baby is in the womb, the spinal column does not fully close around the spinal cord, which then leaves the spinal cord exposed. Spina bifida in Latin means split spine, and according to the Center for Disease and Prevention, there are 4 types of spina bifida. The first 2 types are occulta spina dysraphism, also known as OSD, and spina bifida occulta. In OSD, the characteristics are a single dimple in the lower back, red marks that are usually hyperpigmented. They can appear also as tufts of hair or small lumps, and in this kind of spina bifida, the spinal cord forms incorrectly and causes serious problems as the children grow. In spina bifida occulta, this is a minor form of spina bifida, and it's also referred to as the hidden spina bifida because there are no visible signs. It's usually not harmful. It can cause a tethered cord, and which will most likely lead to pain and neurological symptoms. And again, there are no visible signs, but it is discovered after taking an X-ray of the spine. Meningocele is a third kind of spina bifida, and this causes part of the spinal cord to come out of the back within a sac, and this sac is filled with nerve fluids. There's usually no nerve damage, but it may cause minor disabilities. Here on this graphic I have to the right, you can see the 3 different kinds of spina bifida: spina bifida occulta, meningocele, and myelomeningocele. Myelomeningocele is the most severe form of spina bifida. It's also referred to as meningomyelocele and spina bifida cystica. This form of spina bifida does cause nerve damage and other disabilities because what happens is when that sac protrudes out of the back, it's usually filled with different nerves and the spinal cord all jumbled and tangled together. In fact, 70 to 90% of children with this condition have too much fluid in their brains. Originally, this fluid is placed in the womb to protect the baby throughout their development, but when the neural tube is not completely developed, that fluid is unable to drain, and it causes pressure and swelling within the ventricles of the brain. This sort of damage usually affects the ability to control the bladder or bowel movements. It can cause loss of mobility and loss of movement in legs. I'd also like to point out that this condition of having fluid in the brain is referred to as hydrocephalus. Some characteristics and diagnosis according to the Center for Disease and Prevention are some ways that you can tell a child has spina bifida is high levels of AFP. AFP is an alpha-fetoprotein. Also, when the baby is born, there may be hairy patches or only one dimple on the baby's back. The way spina bifida is diagnosed is there are a series of prenatal tests a mother may take when she receives the proper medical attention during pregnancy. Some of those tests will examine the child for spina bifida and other potential disabilities a child may be born with. The first one would be the alpha-fetoprotein blood test. This measures AFP levels within the blood. When there are high levels of AFP, this means the baby may have spina bifida. Also, another way that they test AFP is through amniocentesis. It measures the levels of AFP in the amniotic fluid that surrounds the baby in the womb. And another test that would diagnose spina bifida would be an ultrasound. With the ultrasound, the doctor is able to take pictures of the child's spine and assess the development. The graphic here shows what a child with myelomeningocele, which is the most severe form, may look like within the womb. As you can see, there is a protruding sac with the spinal cord inside and swelling of the ventricles in the brain, which again is a condition known as hydrocephalus. Some of the effects of spina bifida. Well, it's important to realize that the effects of spina bifida are different for every person. Except 90% of children with myelomeningocele require surgery to drain that excess fluid from the brain within the first to third day of being born. The way they're able to drain that fluid is by placing a shunt that connects from the baby's brain down to the spinal cord, and this shunt stays within the child for the rest of their life. It never comes out. Sometimes they need surgery to expand or to lengthen the shunt. Also, some effects include full or partial paralysis, loss of bladder and bowel control, learning disabilities, depression, social and sexual issues, an allergy to latex, hydrocephalus, which is liquid in the brain, a tethered spinal cord, scoliosis, and in some cases leg and foot weakness. Treatment and prevention. Not everyone with spina bifida will require the same treatment. Some treatment may include surgery for the shunt placement. Braces, crutches, walkers, and wheelchairs are sometimes needed to improve and allow mobility. And it's highly recommended by the Center for Disease and Prevention that anyone with spina bifida achieve at least 60 minutes of movement a day. Prevention, according to the Center for Disease and Control, includes taking 400 micrograms of folic acid every day, if not more, depends on how much your doctor prescribes you. For example, my aunt has spina bifida colta, and when she was having a child, her OBGYN prescribed that she had 1,200 micrograms of folic acid every day. It's important to avoid overheating the body. That means staying away from hot tubs or saunas, and to treat any fever right away with an acetaminophen, which is, again, to prevent the heating of the body. Make sure that if you or the individual who wants to become a mother if they have diabetes or if they are clinically obese, it needs to be under control before having the baby, because being obese and having diabetes make you at high risk for having a child with spina bifida. So some of the history behind spina bifida can be traced. Research can be traced about studying spina bifida since over 2,000 years ago. They can trace research of spina bifida, and this is according to an article titled "The History of Spina Bifida," which was published in 2013. Although it wasn't until sometime between 1618 and 1652 where Professor Nichols, a man from Amsterdam, gave us the term spina bifida. And then almost 100 years later, a man from Italy named Giovanni Battista Morgagni linked lower limb deformity with hydrocephalus and spina bifida. And in 1955, a man in the United States named Dr. Holters had a son with spina bifida. And with his work with a man named Dr. Spitz, they created the Holter-Spitz shunt. Unfortunately, the shunt wasn't able to save the life of Dr. Holter's son, but it paved the way for so many other individuals with spina bifida to survive. According to the CDCP, the Center for Disease Control and Prevention, approximately 1,500 pregnancies a year are affected by spina bifida, 7 out of every 10,000 births in the United States, and that's more than 70,000 people in the United States are living with this birth defect. Shockingly, about 15% of healthy people have spina bifida and are unaware. Now, having a child with spina bifida is very different from teaching a child with spina bifida, just because parents and teachers require different resources and support in different ways. For example, this website is a great resource for parents because it informs families and providers about what it's like to care for someone with spina bifida in the home setting. So it offers quick tips for parents about equipment that may be needed, recreation ideas for all kinds of mobility, and what medical assistance may look like for your child. This resource is also beneficial because it is in English and Spanish, which is great for breaking that language barrier. It also tells the story of a parent and their child with spina bifida. And most importantly, this website offers ability to find resource centers locally. I chose this teacher bibliography because I believe while the teacher needs to know how to accommodate and create the best learning environment for the student, their main goal is to create a safe and productive and supportive learning environment for all of their students in the classroom. So this is a productive website for teachers to access knowledge about students' personal care, their safety, and the mobility abilities for a student with spina bifida. And they also take an in-depth look at the specific needs for this type of student. The second website I chose for my teacher resource would be comes from the Special Education Support Service program. It's excellent for teachers because it offers applicable interventions for their students. For example, they recommend using tabletops instead of desks for some students who are on a wheelchair, or another great tip they said was, if you want to bring the student who is in a wheelchair into a group, maybe raising the table so they can access it easier, or having your anything that's valuable information that you're using often, having it on wheels. That means charts, so you can bring it to the student, move it, make your learning environment more mobile instead of being rigid and in one place. Also, allowing adequate time to complete tasks that involve motor skills. This is vital to promoting a successful learning environment for your students with spina bifida. Some of the research-based interventions that I looked at were Imagine Learning and cognitive strategy instructions. But I'd like to speak about Imagine Learning first. Imagine Learning is an application for the iPad, or for at school and a computer, at home and a computer, that offers literacy activities that are individualized to the level of the student assesses. What happens is they give multisensory practices, and this is vital for students with learning disabilities because when there are learning disabilities, it's important to access every sense the child has for learning to promote the greatest amount of learning that there can be. This means using sight, hearing, sounds, anything that can trigger some sort of cognitive process within their brain. Another great part of this program is that there's continual assessment. That means the child is learning on how they assess that week, that day. This is great for inclusion classrooms because instead of having just special education focused on just that one student in that small class, you can accommodate all of the different learning disabilities in that class, as well as the mainstream learners in your class. And in a case study conducted in 2008 in the Neuro Alto Elementary School, this case study was based on the students with learning disabilities. And in 2008, only 6.3% of those students were testing at the adequate yearly progress goal. Only 6.3% of students met that goal. 3 years later, after using Imagine Learning, 54.1% of students with disabilities were scored at the goal of the adequate yearly progress. That is a huge, monumental surge of 47.8%. Clearly, this program gets great results. Again, Imagine Learning is already aligned with Common Core standards. It is a research-based instruction, and it offers motivation and engagement for each of the students. The next strategy of learning I will discuss is cognitive strategy instruction. This supports the learner as he or she develops internal procedures that enable him or her to perform tasks that are complex. Rosenshine, 1997. Basically, the way cognitive strategy instruction works is taking the time to master the steps of a complex task versus just looking at the task itself. So in a study conducted on the effects of cognitive strategy instruction on the mathematical problems of adolescents with spina bifida, results showed that all students improved as measured by performance on criterion tests of math problem solving. And the way the intervention worked was doing one-step and two-step math equations using cognitive strategy instruction. So how does Imagine Learning and cognitive strategy instruction look within the classroom? Well, the way Imagine Learning looks in the classroom is using it along with any other reading and comprehension intervention classes that are already being conducted at the school. This is an excellent program, again, for inclusion classrooms because you're able to work with every single one of your students to reach their individualized goal. So that means students who have IEPs, students who are in all students with special education have IEPs, but you're able to expand learning within that classroom. And also it works with other reading programs to improve the student's lexile level, thus focusing on comprehension and how to expand and reteach and just really cement those ideas that the student has learned, because a lot of times with learning disabilities, students tend to forget what they have already learned, and Imagine Learning has a great process of reteaching those skills while keeping the learner engaged. The way classroom cognitive strategy instruction looks in the classroom is using visualization. This means diagrams, models, colors, anything that can create a connection in that child's brain. Learning tools, which learning tools are multiplication charts, calculators, counters, or concept mapping, which allows the student to create connections of something that's an abstract term and make it more concrete. And a vital key point of cognitive strategy instruction is having self-checking and monitoring. Through these processes, the child is able to have accountability for their own learning, therefore making them feel empowered, which with students who have spina bifida, sometimes low self-esteem is associated with their disability, and if you can make them feel like they are in charge of their learning and they are capable, then they will be able to succeed. Last, I want to thank you for your time, and these are my references, and I hope that this presentation was beneficial to you. Thank you.